I'm Peter Marathas. I'm Band's Compliance Director. I'm also a partner at Praskauer and Rose. The issues faced by clients with the Affordable Care Act all really are relative to the fact that there's not much that's affordable in the Affordable Care Act. That these government programs increase costs, they don't decrease costs, and they never go down. The biggest issue facing clients is going to be the rising cost of health insurance premiums if they want to continue to provide insurance to their employees. This law from the beginning, this law being the Affordable Care Act, has been nothing but a series of procrastination by employers who have been hopeful that it would go away. And I'm afraid that the message now with the delay till 2015 is that employers will put off doing what they should be doing now, and what they should be doing is using the delay to get ready for 2015, implement programs to identify who their part-time employees are, use variable hour employee calculations to determine whether that's going to help or hurt them, implement communication strategies to identify alternative sources of insurance for their employees. Those who simply do nothing are going to be faced this time next year with worrying about implementation of all of these things for the Act that will go live in 2015. The challenges for small businesses as we move along into the Affordable Care Act are going to be increased cost of premium. The standard is across the country that premium increases are going to go up substantially, in some cases by 50%. So the biggest challenge for small businesses is going to be to find a way to continue to afford to provide health insurance. Working with a smart partner, one of the Band's smart partners will help them to find solutions and implement programs that will control cost. One strategy that employers might consider and have already is to reduce the number of part-time or full-time employees they have to part-time employees. Understanding that, there have been efforts underway, most recently bipartisan support in the U.S. Senate for a bill that is called Full-Time Means 40 Hours, which is directed directly at the Affordable Care Act, and the bill is pretty much says what it is. It would require that under the Act, employers only had to worry about employees who worked 40 hours a week. That would then stem the flow of all of these businesses knocking people down to 30 hours. I look at that and view that as positive in a lot of ways. Number one, it will certainly help with jobs creation, and that has been stymied since 2010, since this law went into effect. But also, from a broader perspective, it demonstrates this bipartisan effort. It was introduced by a Republican and a Democrat senator, this particular bill, and there's been many of them. There's also support in the House, bipartisan support by some of the more moderate members of both parties for this bill. And maybe finally some understanding of the complexities of the workforce that Washington really doesn't understand when they pass laws like this.